our work on the correlation between dermoscopic features and severity in nail psoriasis, a case series of 151 patients. Psoriasis is a common dermatosis with nail involvement in around 61%, and the prevalence in patients with psoriatic arthritis of around 18 to 90%. However, 10% present isolated nail affection, making diagnosis difficult. Knowing that nail psoriasis is a risk factor for progression to psoriatic arthritis, onychoscopy therefore represents a non-invasive diagnostic tool for early detection of nail damage and subclinical lesion in psoriasis. The aims of our study were to investigate the specific dermoscopic features of nail psoriasis and to determine the association between these features and the disease severity. A prospective study was conducted over a 4-year period from January 2019 to December 2022 in the Dermatology Department of Ibn Rud University Hospital Center in Casablanca. Were included all patients presenting nail lesions with a history of psoriasis and or nail affection suggestive of psoriasis with a negative fungal sample. Patients meeting these criteria were recruited and classified according to the Nail Psoriasis Severity Index and the Psoriasis Area and Severity Index. A systematic dermoscopic examination of all nails was performed in all patients. Moving to the results, out of 151 patients, 43% were men and 57 were women. The mean age was 44 years, ranging from 6 to 68 years, and the mean age of onset was 25.58 years. Only 17% of patients had isolated nail psoriasis. The other 83 had associated skin psoriasis. 24% of them had palmoplantar keratoderma. 35% had the scalp affection. 11% had the psoriatic arthritis, and 12% pustular psoriasis, and 18% had erythroderma. Here are some clinical features of nail psoriasis. We have in the first picture distal onycholysis. In the second one, we have bow lines associated with nail pitching. And in the third one, we have trachonicia. And this one presents a typical presentation of crumbling in all the nails, suggestive of psoriasis. The age, the duration of psoriasis, and the number of affected nails reached statistical significance when NAPSI score was used to reflect the severity of nail psoriasis. Nail psoriasis affected both nail plate and nail bed. The most frequently found dermoscopic feature were distal onycholysis with 42%, subungual hyperkeratosis with 36%, splinter hemorrhage with 30%, paronychia with 30%, nail pitching with 31%, trachonicia with 23%, salmon patches with 15%, crumbling with 15%, bow line with 13%, and longitudinal ridges with 12%. The mean PASI score was 17 and the mean NAPSI score was 36. The nail psoriasis might become severe when these dermoscopic features were observed, including nail pitching, onychomadasis, pachyonychia, crumbling, splinter hemorrhage, and paronychia. While leuconychia, bow lines, longitudinal ridges, distal onycholysis, salmon patches, and the subungual hyperkeratosis were not associated with nail psoriasis severity. To date, reports on dermoscopic features of nail psoriasis are limited. Moreover, few studies have focused on disease severity related to dermoscopic parameters. Signs of nail matrix involvement include nail pitching, trachonicia, bow lines, and leuconychia, whereas signs of nail bed involvement include onycholysis, salmon patches, splinter hemorrhage, and subungual hyperkeratosis. In our study, we found that patients with more severe nail psoriasis were more likely to be older, have a longer duration of disease, and have a larger number of affected nails. Age onset was not associated with the disease severity. We had a systematic review in our department which shows the same results. You and associates also came to the same conclusions. Also, the PASI score of patients who present pachyonychia, pitching, splinter hemorrhage, paronychia, onychomadasis, subungual hyperkeratosis, and bow lines were higher than those without these features, asserting the results in all previous studies, suggesting that nail psoriasis is often a nail matrix affection. Additionally, we demonstrated that Pachyonychia, splinter hemorrhage were relevant to the severity of nail psoriasis, while subungual hyperkeratosis, nail pitching, and salmon patches were not. To conclude, nail involvement in psoriasis is common, so nails should always be examined. Recognizing key dermoscopic features of nail psoriasis can optimize diagnostic accuracy, guide prognosis, minimize the need for unnecessary biopsies, and optimize treatment, thus improve patients' quality of life. Thank you.